Hello and welcome to Health Live at Seniors Today. Our topic for today is ENT care and hearing concerns of senior citizens. And I'm delighted to welcome here Dr. Samir Bhargava. Dr. Bhargava is currently professor in HBT Medical College, Mumbai, and the R.N. Cooper Hospital, also in Mumbai. He's also a consultant at the Hinduja Hospital in Mumbai. He is national president of the Association of Otolaryngologists of India for the year 2020. He has been a gold medalist for securing first rank at both the MS ENT and the DORL exam in the year 1991 from Mumbai. An award-winning student, he has done his MS ENT from the KEM Hospital in Mumbai and the D.L.O from the Royal College of Surgeons in London. He has been invited as faculty at more than 70 surgical and cadaveric hospital workshops all over the country since 1996 and has been a guest speaker and panelist at several conferences and workshops. He has authored books, presented papers, and is featured amongst Mumbai's top doctors by Hinduja magazine in 2019 and 2020. He is also an active Rotarian. Welcome to Health Live, Dr. Bhargava.
Mr. Maheshwari, thanks for having me on your program. It's a pleasure to be addressing the senior citizens because everybody has senior citizens at home.
Welcome to Health Live. It's a pleasure to have you here with us, and I would request you to speak a few words about ENT care for seniors and specifically about about the ear and hearing.
Yeah, so as our discussion is basically on hearing problems in the elderly, I've put together a few slides as regards what are the problems that people face and a little bit about understanding of how things happen so that we can correct them. Right, so as we all know that the modes of communication include vision, hearing, speech, and gestures. And whenever there is an impairment in hearing, if it is only a mild to a severe hearing loss, we just say the patient or the person has a hearing loss. But when there is little or no hearing, that's when we label it as deafness. But whatever be the degree, it is always a social and an educational handicap. And most of us who have hearing impairment will definitely vouch for that. So Helen Keller, so we all know her, visual and hearing impaired American author, political activist. So this is something that she had to say, very important, that blindness would separate people from things, but deafness separates people from people. Because if you cannot communicate, you cannot hear, the world is completely silent. And really speaking, hearing impairment has not got its due because it cannot be seen. So that's why the deaf generally suffer in silence. And unlike blindness, which people will overtly sympathize with. So if you see someone with a walking stick, they will help them cross the road. But with deafness, quite often it actually provokes ridicule. And you'll be surprised to know that this is the second most common cause of years lived with disability. And depending upon whether we are in the developed world or in the developing world, the hearing loss among people can be anything ranging from 6% to 10%. So that's a huge population, and that's why it needs to be addressed well. Although diverging from our topic today, but 1 lakh children are born deaf every year in India. And you all know that if you cannot hear, you cannot develop speech and language abilities. So coming back to senior citizens, almost 1/3 of people above 65 would have some significant hearing loss, but only 20% of these will seek assistance from the doctor, quite often in the form of hearing aids. And then also only 16% will be just leaving the devices. They will not be wearing them. So very briefly, let me just try and recapitulate some anatomy that one had read in our school or early college days. So if you look at this diagram of the ear, so this is the ear from the outside, this is the ear canal, this is the ear drum, and then you have the hearing bones, and then you have the nerves. So this is the ear drum, these are the hearing bones, and this is the nerve. So you have an outer ear a middle ear and an inner ear. So anything that happens in the outer or the middle ear quite often can be managed with medicines or surgery. But if something goes wrong in the inner ear, that's something that we need hearing aids. So graphic demonstration of how the sound goes and vibrates the drum, then goes to the bones and then reaches the nerve. So whenever we are talking in terms of hearing loss, the sound intensity is measured in terms of decibels. So when we whisper, our decibel level is between 25 and 40. If we can't hear that, we label that so-and-so has got a mild hearing loss. But if you cannot hear someone regularly, normally talking, then it's a moderate or a medium degree of hearing loss. And if you cannot hear the horn of a car or the movement on a road, that would go into the moderate to severe hearing loss. And if you cannot hear a plane or a sawing instrument or a train, well, that is where it would be a profound hearing loss. So whenever we are checking this, when we do it very cursorily, it's in the form of just voice tests. But otherwise, we use an instrument known as a audiometer, a pure tone audiometer or a speech audiometer to know exactly how much is the hearing loss and what is the nature of the hearing loss. And then we grade it into the various categories, as I mentioned, ranging from mild to severe to profound. So profound is where you label it as kind of stone deaf. So coming back to the types of deafness, you can have a problem with the conduction of sound, which is the sound from the outside carried to the eardrum and carried to the bones to the nerve. So anything that is a conductive hearing loss is up to the bones, then it goes to the nerves, and if it's a combination, then it's called a mixed hearing loss. And most of us face problems in the external ear. So we are in the habit of using earbuds and trying to clean our wax, and we'll end up pushing it inside. So you can get impacted wax as one of the common causes of a hearing loss. Fungus is an extremely common cause of hearing loss in the monsoons particularly, or also in swimmers. So this can cause itching in the ear and pain in the ear, and of course a blocking in the ear. And also in diabetics, we need to be very careful about fungal infections. Sometimes when we're trying to clean our ear, we land up leaving behind the cotton, which works as a foreign body. We forget about it, and that can cause a hearing problem. And of course, you can have polyps and tumors. In the middle ear, very often you must have heard of people having discharge from the ear. So that's an infection of the middle ear, which is one of the very common causes of hearing loss. Sometimes an injury to the ear can result in a hole in the eardrum or a perforation. And sometimes you have some problems in the hearing bones, which is genetic. It's common among the south of India, in the northeast, among certain communities in Gujarat, called as otosclerosis, and of course could be tumors. Coming to the nerve deafness, the problem by far commonest is presbyacusis, which is age-related hearing loss. And this is what affects a large number of people. Infections also can lead to nerve deafness, and COVID-19 also, there are reports showing that there could be hearing loss because of the viral infections. Very often, if there is poor circulation, you can land up with a hearing loss due to a cardiovascular cause. Diabetics, just like many organs are affected, so also the nerves of the ear. Certain medicines, so medicines which are used for tuberculosis, sometimes for cancer, sometimes even plain and simple medicines for malaria, these all can cause ototoxic, they're called ototoxic drugs, they can cause hearing loss. And of course, injuries and tumors to the ear also can be a cause. So whenever, as I said, there's a conduction hearing loss, you can treat the cause, even surgery, and most of the time you can rectify the problem. But if it's a neural deafness, a sensory neural hearing loss, then these patients most of the time require hearing aids, sometimes surgically implanted hearing aids, and other modes of therapy. So when do we realize that we are having a presbyacusis? So we'll find that sometimes the speech of our the persons we are coming in contact becomes mumbled, slurred, You want to ask people to repeat. You tend to start speaking loudly. You start making a mistake between sir and thir. So certain high-pitched sounds may become difficult to hear and tell apart. In noisy environment, you find it difficult to understand conversation. And sometimes you find that you are able to hear the male voice better than the higher pitch female voice. Of course, sometimes this can be deliberate, but typically the age-related hearing loss affects more the higher frequencies, which is the female voices. And of course, sometimes you can find that certain sounds become annoying and very loud, and you land up with ringing sounds in the ear, what is known as tinnitus. So that's where you can do something about this with the form of hearing aids, which are basically catching the sound with the microphone, converting this sound to electrical activity, magnifying this, and then reconverting it into sound. So you have various types of hearing aids. You have this tiny one that goes in the ear, or the one that fits behind, what is known as the behind the ear, BTE. We've got tremendous technology, particularly in this century, and newer techniques come up with newer technology. So we have behind the ear hearing aids, you have in the ear, you have completely in the canal, the so-called invisible hearing aids. And today we do not have any of the older analog hearing aids. It's more, everything is digital, and digital hearing aids have a huge amount of benefits. So this is how the hearing aids will work. They carry the sound from the processor into the canal, and then we start hearing. So the main difference between these digital hearing aids and the old analogs is that an analog will only magnify the sound to make it louder, but a digital hearing aid will break the sound, improve it, reassemble it, and then amplify it. So most people who have used hearing aids complain that they are not comfortable. They cannot make out the direction of sound. They find that there's too much of noise feedback that's happening. Whenever there is a background sound, it's too loud. So all these things can be reduced with the digital hearing aid. People who have a hearing loss in both ears commonly ask the question, Doc, should we use something only for 1 year? Well, nature has provided us 2 eyes, nature has provided us 2 ears. And that's why you will be able to hear better with the stereo effect. Particularly, you can understand speech better, the sound is more balanced, the listening is less exhaustive, and safety. So if you're crossing the road and if you cannot hear sound from one side, it can lead to a mishap. But these hearing aids are not well accepted because there still is a social stigma. Oh, I am not that old to wear a hearing aid. Also, people find that it's difficult to maintain. There is frequent cleaning required, battery changes. So today hearing aids are available which are rechargeable. Some people complain that their ear gets blocked, which is called the occlusion effect. So that is something that you need to get adjusted to. And of course, if it's a poor fitting hearing aid, you will get this kind of a feedback sound. So it needs a better fit. So some of these fancy Bluetooths may actually be hearing aids. Now, can hearing aids be implanted? So technology is there, although there are a lot of ifs and buts with that, where we directly implant the hearing aid onto the hearing bones, so that the ear is open, you don't have this occlusion effect, it improves the cosmesis, you can even swim or bathe with it. But yes, this technology is extremely expensive, very, very limited reasons why you should be doing that. And of course, also we need to remember that if the hearing loss progresses, then sometimes we have to redo this surgery. So it's not something that we are advocating very freely nowadays. What if you cannot hear at all, even with the best hearing aid? So patients who cannot hear with the good hearing aids can undergo cochlear implants. Now, there's a very common, misconcept that cochlear implants are only for children who are born hearing impaired and completely deaf. Implants in India, only 95% are for children, only 5% for adults. Whereas if you go abroad, almost 50% of the cochlear implants are for adults. So this is the only sense organ that humans have been able to kind of replicate. So we implant something bypassing the damaged part of the ear and directly stimulating the hearing nerve. So I will show you how that works. So you have the sound coming on to the processor over here. It goes into the coil, and then from there it goes directly into the cochlea, and then the sound is heard. So there is really no age bar. Even at 80, if one is absolutely physically fit and desires a better hearing, a better quality of life, you can always go in for this surgery. Of course, there are specific indications for this particular thing. Before I end my short presentation, there are patients who have only hearing completely lost on one side, what we call as single-sided deafness. So there are devices like a cross hearing aid. You have a hearing aid which is fitted onto a spectacle, and then you start catching sound from one side and then transmitting it to the other side and start hearing there. Also, there is a device called a PAHA, a bone anchored hearing aid, which you can fit into the bone and then have the device fitted on top of that. And this is how it would look. So with newer and newer technology, lots of new things have come in, which can help not only the younger generation, but even our senior citizens.
We have a very interesting question which has come from Mr. Shantaram Ramdurkar, who is 75 years old from Pune. He says, since the lockdown, we've depended a fair bit on webinars, often two a day. How does one take care of ears while listening? And he has survived the COVID-19 attack in June. So he asks whether he needs to take special care.
No, so answering the second part of the question, any special care post the COVID? So if you've had a mild infection, then there is really nothing that one needs to do further. But yes, you have to continue to exercise the same precautions, which include the social distancing aspect, the wearing of masks, and of course the hand hygiene. So even if you had an infection, we need to still exercise the same care. As far as care from the ear point of view is concerned, so as I said, there are very few reports that are coming in where people have had hearing loss even with a COVID infection, but those are very few and far between. We've not seen really too many cases. Listening to webinars, well, so as long as it's not too noisy, which means people are not shouting on the webinars, then it's fine. You're not going to hurt your hearing by listening using your headphones or your earphones and for a couple of hours in a day. So you're fine to just carry on with your webinars. There's no problem, no special care. Yes, but if you're using a lot of earphones, then in that case, if you have a tendency for wax, then you may land up pushing that wax in and start experiencing a feeling that the ear is getting blocked every time you use those earphones. So in that case, you may need to visit your local ENT and get it cleaned out, syringed out, or suctioned out, depending upon the preference.
Doctor, what do you think about dealing with the noise on news channels these days?
so somebody's music is somebody's is noise for somebody. So yes, if you have that much of noise misuse, or if you call it abuse, then yes, it can be detrimental to your hearing. But yes, if you're exposed to that, on a lighter note, of course, if you're exposed to very loud sounds for long periods of time, then they can lead to hearing loss. There is something known as a temporary threshold shift, which means that the temporarily, so if you go to if you're standing next to a loudspeaker, or if you're standing in a area where there is very loud music, you may feel your ear going numb for some time, for a few seconds or even for a few minutes. But if this exposure is for a longer period of time, you can actually land up with a permanent hearing loss. And that's what happens in people who are in occupational noise hazards. If you're working in a factory, or if you're close to an aircraft, you can actually land up with a permanent hearing loss. So you need to use devices so that they protect your ear, protect your hearing, noise cancellation, headsets, everything.
So we have a question from one of our regular attendees, Katie Davanchi. She asks, Doctor, my husband is 75 years old, has a hearing problem, and he was told to buy hearing aids, but some people who have said they don't work well as they hear a buzzing sound when they wear. And also they were told no water should go in and it will not work even by mistake. Hence he is hesitant to buy an expensive aid which may not serve the purpose.
Yeah, so as I mentioned in the talk, that today digital hearing aids give you far better hearing quality as compared to the earlier hearing aids. So it depends on many factors. It depends upon the degree of hearing loss, the age of the patient, and what kind of hearing aid are we using. So hearing aids have channels, and channels are like filters. So if you have a hearing aid which is only a 2 or a 4 channel, you will hear, but sometimes you get a lot of noise from the surrounding areas and one is not happy. So if you have a better channel hearing aid, which means it is filtering out certain noises, the digital hearing aids, these are the ones which actually come with number of channels. They can range from 2 channel to 20 channel to 40 channels also. Now what channels means is that these are filters. So they filter out the unwanted sounds. So if the hearing aid is of higher channels, then you get a better hearing. But yes, that means that the cost also increases. So depending upon one's profession, one's requirement, you don't need to go for a very, very high channel, but at least a 6 to 8 channel is the one that should be good enough. And these are moderately priced. Also, today's hearing aids come with a lot of good technology. You know, they can be Bluetooth compatible and they can be compatible to your iPhone and to your phone and everything. So you can get much better hearing, much better quality of hearing.
We have a lot of questions that have come around wax. One is how often should one get one's ears cleaned for wax or check, even if there's no apparent hearing loss?
So wax is really a normal secretion of the ear canal, and a little bit is always required, because if your ear is completely dry, it will feel itchy all the time. But because we equate wax with dirt, why do we clean our houses? Because we think they're getting dirty. So if you equate wax with dirt, you will want to clean it every day, which is completely not required. So the earbuds should really not be used at all. If you use earbuds and you have a tendency for wax, you'll end up pushing the wax inside the ear. And these are the patients who need to go to the local physicians and get that cleaned out. So on a regular basis, please don't use earbuds. Once in a year, you can go to your local ENT doctor and if required, get it cleaned out. There are some people who do not have that much requirement also. So you do not really need to do anything. But definitely not to use earbuds.
We have a question from an anonymous attendee who asks, is wax oil safe to use? She's 71 years old.
Wax oil.
Yeah.
So in the good old days, what was recommended, use oil in the ear because that will soften the ear canal skin and will help clear the wax. Well, if it is contaminated, you will land up with fungus. So the problem is in the use, the way we use it. If you use oil once in a while, you've boiled the oil, brought it to room temperature and have used it, there's no problem. But do not keep using it on a regular basis.
We have a question again from an anonymous attendee who says, if water gets in the ear while bathing, is it okay to put a drop of alcohol to get the water out?
So if you have the water not coming out, it indicates that there is some reason that the ear is getting blocked inside, the water is not coming out. So that needs to be, corrected. Alcohol having an hygroscopic effect is probably going to help dry that, but that's not the solution to the problem. You need to actually find out why the water is not coming out, which indicates most of the time that there is wax inside. But I would definitely not recommend use of anything in the ear without it being examined and recommended.
A similar
question. We don't need to sanitize our ear canal using alcohol.
We have a question from S. Bhaskaran, who says, I'm 60. Should we as seniors visit ENT specialists for cleaning of wax? And what should be the frequency?
Yeah, so as I mentioned earlier, that if one doesn't have a tendency for wax, then you need not really go every year to your doctor and get it cleaned. If you have a tendency, generally once in a year or year and a half is what the total amount would accumulate. If one is a senior citizen, one should do a baseline audiogram, because then you can pick up a early onset of hearing loss. And if there is something that can be done to prevent or correct that, then those measures can be instituted. And having said that, once you do an audiogram and it shows an issue, then at least once in 2 or 3 years, you should get it repeated.
We have a question from Colonel B.G. Duggal, who asks, I'm 77 years old. 2 years back, I suffered a series of vertigo attacks and I could not bear the high-pitched sounds in movie halls or airports.
Yes.
After taking Vertin and physiotherapy, I've recovered. What precautions should I take to avoid the episode again?
Yeah, so generally, people with a high frequency hearing loss, so as age progresses, you develop presbyacusis. So you develop what is known as a recruitment phenomenon. So which means that suddenly at a particular frequency and decibel level, the noise levels become so loud that they can actually make you vertiginous. So the answer to that is definitely avoid all areas which are noisy. If you happen to go to some place which you cannot avoid and is a noisy area, you can use even a cotton ball in the ear, or you can use the ear, you get these plugs which actually cancel out the outside ambient sound by about 10 to 15 to even 20 decibels, and that would keep you comfortable.
Right. We have a question from Rajni Seth, who asks, Doctor, I had pain in my right ear. I got the cleaning done and a big wax lump was removed about 2.5 weeks back. Got an audiogram done as well, which was normal. But now I'm experiencing some discomfort and pain in the same ear. What could the issue be?
Yeah, so if it was cleaned up just a couple of weeks back, then the wax would definitely not reaccumulate in such a short quantity, a short period of time. But unless something has still got left behind, and if that caused you irritation and you happen to scratch the ear, so it's most likely that this is an otitis externa, a small inflammation in the outer ear canal, which is starting to give you pain. Also, one must remember that fungus, because there is still humidity in the air around, and you can have a fungal infection developing. So if the ear is still hurting, it would need to get rechecked once again. Wax would not reform in such a short period of time.
We have two questions, one from an anonymous attendee and the other from Asha Virmani, who asks, is there any remedy for tinnitus? What should one do when you have itching difficult to control?
So tinnitus is an unwanted sound in the ear that people experience, and tinnitus can have various causes. So there is a subjective tinnitus which only the patient is able to hear. There is an objective tinnitus where someone standing by the side of the patient also can hear. So it needs to be thoroughly examined, analyzed. An audiogram needs to be done to find out what is the degree of hearing loss. And once the cause is determined, then you can treat. There are certain tinnitus which can be treated, and there are some where they continue. So if I give you a kind of a rough ballpark figure, if it is due to a nerve deafness, about 60 to 65% of tinnitus would go away completely. About 20 would reduce significantly, but yes, 15 to 20% of tinnitus can sometimes stay behind. So if you've diagnosed what the cause is and you've realized that it is not something that is serious or life-threatening, then you need to ignore that sound. So you need to condition yourself, the mind, to just ignore that sound. So we need to evaluate and then decide on the treatment.
Doctor, what about people who work in certain scenarios? For instance, when I used to work in a newspaper office, there was a teleprinter off, which was running at the background, and even when one would come back home, you would have that ringing in your ear. Also, I know a radiologist friend of mine, he says that the sound of the sonography machine, the beep keeps ringing in his ear. So what do you do about that?
Yeah, so this is an occupational hazard, and today we have headsets which will cut off the sound by 15 to 20 decibels and will protect your ear. So depending upon the duration of exposure that one has, so according to the Occupational Diseases Act and the Workmen's Act, anything more than 8 hours of exposure at 80 decibels is enough to damage your hearing. And for every increase in the sound intensity level, which is say 5 decibels, 3 decibels, the duration of exposure by which you are still safe is cut to half. So if you have even half an hour of exposure to a loud sound like a loudspeaker or a factory at 100 decibels, you can damage your hearing permanently. But if you can use these headsets which reduce the sound by 20 decibels, you straight from half an hour can increase it to 6 hours, 8 hours exposure without it causing a problem. So prevention is the most important thing as regards this happening. Cure, if it already happened, sometimes is difficult.
Thanks. We have a question from Ashok Kumar Grover, who says, my father is 87 plus and extremely hard of hearing, resulting from gradual loss in the beginning and then leading to severe loss in both ears. Just manages to understand a few words after repeatedly loud speaking. No hearing aid works. Can a cochlear implant help? And is it desirable? Perhaps desirable at this age. How much would it cost in Delhi? What if after the implant found that the auditory nerve is also dysfunctional?
Yeah, so patients who do not benefit with the best hearing aids are the ones who are eligible for a cochlear implant. So cochlear implant is where we are implanting the electrode directly into the nerve, and there are always some hair cells in the cochlear nerve which are enough to carry the sound to the brain and get it processed. So most patients who are physically fit and can undergo a surgery, and it's like any ear surgery, are candidates for hearing for a cochlear implant. Because what the implant would do is improve the quality of life for the individual. And we should not consider age as a cutoff criteria. I mean, in India, as I mentioned, I showed you that 80 and 82 years old is probably one of our oldest patients. And abroad, you have patients who are even 90 and 95. So provided one is medically fit, is fit enough to withstand the surgery, they can go ahead. We would investigate the surgeon, the patient initially to make sure that this patient will benefit with the implant. And if it is fine, then you can go ahead. Your father would do well with a cochlear implant. The cost would depend upon the kind of implant, because these implants range from 6 lakhs going up to even 13 or 14 lakhs, depending upon how sophisticated the implant is. But yes, depending upon which is the best for the patient, he can go in for that particular implant.
We have a question from Rakesh Pal, who says, I'm 65 years old. I live on the 34th floor. Every time I reach the ground floor, my ear pops. What can I do to prevent that from happening? Can this cause a hearing loss?
So as I understand, he's going down in a high-speed elevator. And this is a little akin to what happens when we are on a flight. So the eustachian tube functioning of the individual, if it is not up to the mark, then you can experience this feeling that the ear is getting blocked, when you're descending. So what he should do is, yes, you need to basically check out if you have some kind of an upper respiratory issue, some obstructions to the eustachian tube. Swallow. So what do we do when we're on a flight? We either use a lozenge or a sweet and keep swallowing while the flight is starting to descend. And that's the same thing that he should be doing. Provided he does not have any infection in his nose, throat, he can gently do the valsalvas, which is block his nose and his mouth and try popping his ears. So if he does that once in a while, it should not do any harm. But he should get, if it's happening every time that he is in that elevator, he should get it the ears examined.
We have a question from Premlata Agarwal, who says, I'm taking Zocon 400 mg weekly for 3 months for fungal infection in the ear canal. She's feeling relief, but how long should she take it because it is still itching?
So most of the time, ear canal fungal infections can be treated with local antifungals. It is very rare that we need to really start the patient on a oral antifungal. Is she diabetic? And is there, is she in the habit of using earbuds and constantly cleaning her ears? Because most of the time, as I said, that a good cleaning of the ear by the ENT doctor and use of the local antifungal drops and painting certain chemicals in the ear are generally good enough for the infection to come under control. It's very, very rare that one needs to, use an oral antifungal, and that too for that long a period of time. She needs to get it evaluated again as to why she is needing to, use that antifungal for so long. Check if she's not checked her sugar status and her HB1AC to see if there is any diabetes.
We have a question from Gurdeep Straw, who asks, can you be infected with COVID-19 through the ears? How does one sanitize one's ears after exposure to crowded places?
Yeah, so provided your eardrum is intact, there is nothing that is going to go in. So you do not need to do anything to sanitize the ear. Also, there is no reports of any COVID infection via the ear, because as I mentioned that it's like a one way there, your eardrum is blocking off and there is no way that the virus can enter in there. So the entry point for the virus is the nose, the mouth and the eyes only. So if you are in a area where you think that it has been kind of COVID infested, then in that case, come home and just wipe your ear canal with. You can clean your pinna with soap, making sure that the water is really not going inside, and just clean the outer part of your ear canal again with soap and a dry cloth, and you should be fine.
Doctor, we have so many questions that have come in for you. Uh, I don't think we are going to have the time, but I'm going to take a few questions which have come in. One is from Kulsum Vanvati, who says, sometimes I feel a sort of whizzing sound in my ears. I'm 80 years old.
So buzzing sound, whizzing sound, whistling sound, this all comes under the category of tinnitus. And if it is very occasional, fleeting, and not bothering the patient, then you can actually just leave it alone. But if it is constantly there and it is disturbing to the patient, then it needs to be evaluated. And the evaluation can happen with an ENT examination and an audiogram. And if the ENT surgeon finds it fit to investigate further, then in that case, he or she may want to take it further. But most likely, these sounds at 80 would be a part of the nerve weakening process, the presbycusis.
We have a question. There are quite a few questions which have come around ear itching and ears getting dry. So Jankana Modi says, my ear gets dry. Can we put oil drops? Sangeeta Kedia asks, how safe is it to use Candiderma cream when there's a lot of itching in the ears?
Yeah, so use of oil drops once in a while is fine, and quite often it becomes a habit. And that habit, so you feel itchy, you feel scratchy, you use the earbud or you use your fingernail, and then that habit keeps getting perpetuated. So it's very important that we need to, one, reduce the dryness. You can use that any of the medicated oils. Along with that, use an anti-allergic. So that cuts down on the itching sensation. So it makes you not want to use that earbud or the fingernail going inside. And that's how you can carry, you can curb that habit. So once in a while, the use of the drops, if you're using the home oil, then you need to boil it, cool it, and then use that. Otherwise, you can use the ones that are available in the eardrop form. What was the second question, Mr. Maheshwari?
The second question was Candidoma
Yeah.
cream for itching.
Yes. So again, you need to determine what the cause is and correct that, rather than use a cream or a drop, for every a problem. So Candidama would be containing an antifungal. It would be containing a steroid based and something to reduce the itching. So if the things don't settle down within just about 4 or 5 days, then you need to get it checked again and not keep on using this, because some antifungal creams contain a steroid, they contain an antibiotic, they contain an antifungal, and use of this indiscriminately can actually be counterproductive. So I would suggest that please do not just self-medicate every time. If the problem is persisting, get it evaluated.
I'm going to ask two more questions. One is by Firoza Pitawala, who says, I'm 63 years old and get ringing in my ears. I'm an asthmatic too and have to take an Aslan inhaler. And I also have to take a thyroid medicine. Does this affect the ringing?
No. So using your inhalers or using these do not cause any problem as far as the tinnitus is concerned. There are certain medicines that we would like to avoid if there is tinnitus, and aspirin is one of these, because sometimes you can land up with tinnitus with the use of aspirin itself. So, and certain ototoxic drugs like the TB medicine drugs, as I mentioned earlier. But the ones that she is using, no, these do not lead to any increase in the tinnitus.
One last question, Dr. Bhargav, from S. Bhaskaran. And this is just an overall thing. What kind of precautions should seniors take to protect the ear and hearing? Any do's and don'ts that you would recommend?
Yeah, so the first thing is do not use earbuds inside the ear, which means that you will land up either hurting your ear canal skin, or sometimes if your hand happens to shake, you can land up damaging your eardrum. So we see every week patients coming with a perforated eardrum because of the use of earbuds or some other sharp and fancy instrument. That is one. If you want to clean your ears, just use a thin cloth on and roll it on your little finger and just clean the outer part of the ear canal. That is as far as the local external protection is concerned. Coming to the protection of the nerves, well, you need to make sure that you do not get exposure to excessive noise, do not use too much of cell phones, do not listen to very loud music. The other factors that can affect your hearing are the cardiovascular and your blood vessels thickness, and smoking. So smoking also hurts all the nerves of the body, the circulation of the body. So smoking is something that can damage hearing as well. If you have any hypertension issues, diabetes issues, please control that, because that in the long run will ensure that your nerves don't get worse. If you have a cold, a cough, do not blow your nose forcefully, because you may land up sending that cold and cough by, if you're trying to clear your nose, always try to block one side and then blow out, and not pinching both sides, because when you do that, the back pressure effect goes into the ears, and that can cause the nose infection to land up in the ear. Please take medication if the colds last longer, because sometimes this cold can even travel into the ear. If you are having a cold or a cough, bad cough, preferably do not fly, because you can land up damaging your eardrum if you have a bad cold and if you happen to fly. So these are some of the broad measures that one can take to protect the ear and the hearing.
Thank you very much for your time. And we've just spoken about the ears, and there are questions which I can see about the nose, and I do know that there would be a host of people who would want to speak to you about snoring and sleep apnea. So perhaps we must have a sequel very soon and have you here once again. Thank you very much, Dr. Bhargava. It was a pleasure having you here.
Thank you very much, Mr. Maheshwari. I'm sure because of the paucity of time, but let me assure you that I'm all yours.
Thank you very much.